Meanwhile, we will be starting with the valedictory function of this particular conference. In the valedictory function itself, we are expecting to declare the names of winners of this competitions, both poster and oral competition. I hope there will not be any issue in declaring the names. Dr. Christian, do you feel it will be comfortable to declare the names, or we should take a little longer time for that?
I think we will declare one candidate only, no, Dr. Patil?
No, three,
only one.
Three per group, 3 oral and 3 poster presentations.
Okay. Three each. Okay.
Yeah, per category there are 3.
So I leave on Christian's wisdom, this oral presentation. Okay.
I think Dr. Christian has finalized, earlier juries for poster presentation, they have finalized the 3 names.
Mm-hmm.
We have the name already for the poster.
Yeah. They're given marks, I think. Marks were given yesterday.
No, sir, we have not received the name result as of yet.
Okay.
It should be still with Dr. Christian only.
For the poster session, excuse me, for the poster session, we can give the name now.
Sure.
Hello?
Yeah, you can declare, Christian.
Yeah,
Names of the
go ahead with
winners of the poster session.
So I ask you 5 minutes to go back to my document and to find the good name. This is the...
Just a minute, sir.
Yeah. So...
One minute, sir, please.
Dr. Patil, I sent you an email yesterday.
Yeah, that's what I'm retrieving that information. I'll share immediately. Yeah.
It's only my selection, but I don't have the feedback from the others.
No, we considered that as the final evaluation. That was our impression. Yeah. Follow up now. Tell the name.
So from my side, I can open the presentation. Were very good and not easy to select the best one. And from my side, the selection, and I hope that everyone will agree, the best poster was the poster from Dr. Meenakshi Gupta on in silico studies of plant-derived natural compounds from Dawa ul curcum to explore their activity against hepatocellular carcinoma. This was my first selection.
Very well evaluated.
Do we need to, if I remember, there are 3 prizes?
Right.
3 prizes, yeah.
Okay, so the second one was the poster from Mrs. Arati Ashok on organ-on-a-chip, a novel approach for predicting cytotoxicity. Very interesting, also, and well-presented works. And the third award was for Dr. Rakesh Kumar Ponada on QSTR modeling for predicting reproductive and hepatotoxicity. Congratulations to all these very high scientists and promising scientists for the very good poster. I was very happy to be part of this jury, and as representative and of Episkin and L'Oréal, I am very, very happy to support such event and to motivate next generation of scientists to invest more and more on alternative method. And thanks for Society to Alternative to Animal Experiment to allow this competition to be done.
Thanks, Dr. Christian. This is for poster presentations.
Yes.
And what
Will it be, will it be possible, Christian, to also come to take a judgment about the oral? You just disclose, you just declare, and we will see if we concur with you.
For the oral presentation?
Yeah, yeah.
You want I give my selection?
Yes.
I'm not sure that it should be normally a collegial decision, but from my point of view, and all the presentation were very pertinent, even if some network trouble happened, but I particularly appreciate the presentation from Dr. Vishal Kumar on effect of hydroalcoholic extract of Centenella asiatica on free nitropropionic acid induced Huntington-like symptoms in adult zebrafish. This is my first position.
Yeah, I do concur with this.
I too.
You can have a different opinion.
Yeah, no, I think you.
That is what I have also done, like ranking, right?
And
What
the
about second prize?
For the second place, I put in second place Deepali Sharma for effect of quercetin on streptozocin induced memory dysfunction in adult zebrafish. Open to discussion.
Yeah, I think Pooja's presentation on COVID-2 also something different because in my view, Pooja Singh was also made good attempt in my whatever I conceive, slightly different than what zebrafish theme. Anyway,
Dr. Akbarsha will make the last decision, and in between he will decide.
Okay. First is fine. Whatever you selected, that Vishal is fine. I also concur with the selection of Christian. And anyway, third one, if we can.
We can come back to the second, and for me, the third one, the third one, I put in third Mrs. Avneet Kaur.
Yeah, definitely.
Yes.
I have my
Yes, Avneet is good. Yes.
for third position. Second, we can Avneet Kaur on COX-2 thing was good. One attempt, good.
It was very interesting also, and good mixing of in vitro, in vivo, in silico approach, and good combination. I like it.
Sure. So we can,
for Pooja, what I regret a little bit, to my opinion, it was a lot of in silico approaches, and it was more pharmacological. It was a very interesting job, work, but in terms of alternative method,
yes.
This is why I didn't put it in second.
So in that case, sir, we third. I ranked almost similar, slightly degrees higher than this Deepali. So we have now 3 people. So we can declare. I think now Dr. Patil or Dr. Kishan, you can declare. So first one is
Vishal Kumar.
Vishal Sharma from ISM Moga.
Yeah.
The second one is this Deepali Sharma, again from ISM. And third is Miss Avneet Kaur from SGT University, Gurgaon, and maybe she was also with Dipsaru for some time. Okay.
Yes, sir.
So it's fine. Akbar Shah, do you have any other?
Agreed, sir.
So we declare it, I think.
Yeah.
Yes, sir. Please declare this is good.
Yeah.
So
Perfect.
Done.
Congratulations
Have you
to the
noted
winner.
the sequence? Huh?
Yeah, right. We have
Patil?
noted the sequence now.
Have you noted the sequence of the
Yeah,
winner?
so it has been noted now. Yeah.
Okay. So good clap for every.
Thanks a lot. Thanks a lot. And I'm sorry that
Thank you, sir.
There's slight miscommunication, and but still we have come up with the final list of winners, and I congratulate all the winners of
Yeah,
oral and
great congratulations.
Thank you,
and
sir. Thank you.
Thank you, sir.
Good research, do novel things, don't do repetition, and look for available, plenty of literature is available. When I was doing PhD, I used to come National Medical Library in Delhi from Lucknow to see read some journal, and 30 paisa per page photocopy was there. And we give in order in 10 o'clock, then we see a movie, and then around we will come and collect our reprints, photocopy. Now internet is there, everything is there, sequencing is there, PubMed is there, PubChem is there. So you are lucky people, very different era you are living. And earlier Sigma was not operating from India. We used to import our chemicals from St. Louis and go to airport to pick our chemical.
Right.
And now Sigma is based in Bangalore and Hyderabad, all regions, everything is available. Fetal bovine serum was not available for culture work. We used to import from America, infection and all those things. When I did PhD in my 80s and 90s. So now you people are lucky, networking is there. Lots of things are there. Do good work and please do which you can do all the time. And with small objectives. Don't
Yeah.
think what too much lofty. Don't
Right.
think that your drug will be in market by tomorrow. If you are pharmacist, you know how much time it takes.
Yeah.
I think and your director told me 10,000 compounds were X-ray screen, out of that 100, then brought down to very limited and one number. So I must
Yeah,
congratulate everybody and to them and to your mentors also. They should also work with them to
True.
guide you, to lead you, to mentor you, not just to
Right.
send your thesis. They should get involved. Publication is also becoming very difficult nowadays. Every journal now is charging $3,500. So it comes in Indian terms
Yes,
around.
sir. We'll have to sum up this session.
Yes, sir. Sir, please continue with your session. So thank you very much to everybody.
Thanks a lot, sir. Thank you, everyone. I'm sorry to intervene in between the very nicely ongoing process of evaluation and all. I'm sorry for that. But we were having a limited time span for this particular session. So
Sure.
we are rapidly concluding the session now, and we are going to the valedictory function of this conference, for which Honorable Vice Chancellor of DIPSRU, Dr. R.K. Goyal, sir, has already joined. President of Sai India, Dr. Y.K. Gupta, sir, is also there. I request both of them to please unmute. And let's start with the valedictory session here. I'm taking just 1 minute to sum up, particularly my role in this whole conference that was given to me by Dr. Akbar Shah, sir. It was a very nice experience to be a part of his team and to arrange for all these sessions, for which our Vice Chancellor, sir, has generously given us funding. He has guided us. He has attended all the meetings which were conducted for arrangements of this particular conference. I'm really thankful to our Vice Chancellor, sir, for such an immense support that he has extended to this particular activity. Regarding other people who have supported in this particular event, Dr. M.A. Akbar Shah, sir, actually he was the main organizer of this particular conference. He has contacted all the speakers who were there on board. He was responsible for inviting all of them, and they joined us because of Dr. Akbar Shah's connections, Dr. Akbar Shah's involvement in the kind of alternative developments that he is doing since last, I know, since last 2 decades. But his work is still more, and because of his connections, we could have all these international speakers on board in this 4th annual conference of Sai India. I'm very much thankful, sir, that you coordinated the things in such a nice manner that even anyone could have arranged the things in such a fashion that they have worked out. Just your input. I'm thankful to Dr. Raisuddin sir, who was very critically looking at each and every arrangement that was being done, starting from uh, uh, preparation of the timetable, starting from writing the names of events and all. I'm really thankful to him for his input. Dr. YK Gupta sir, from his very busy schedule, still he was calling me in the morning. He was asking for the details. He joined the meetings and all. I'm really thankful for this whole support that these stalwarts have given us. And because of their involvement, we are here and we could successfully organize this particular function. I'm especially thankful to my colleagues, Dr. Sachin Kumar and Dr. Anup Kumar. They have stood by me for almost 1 month, and it was their involvement, their support, and only their support, because of which I could succeed. I could come up to here. My moral did not go down because of these two individuals. I'm very much thankful to them. With me was Dr. Prabodh Sharma, our associate professor and in charge of IT department. Whatever facilities of this Zoom platform we have got, and uninterrupted connectivity, uninterrupted flow of events. It was all because of Dr. Prabodh Sharma and our IT support people, Mr. Vikas and Mr. Pankaj. I'm thankful to my friend Dr. Saurabh Dahiya, my other colleagues from pharmacology, biotechnology department, our deans, our directors of DIPSAR and School of Pharmaceutical Sciences, which are schools coming under the aegis of Delhi Pharmaceutical Sciences and Research University. So from the behalf, on the behalf of Sai India, I thank DIPSARU, and on the behalf of DIPSARU, I thank the office bearers of Sai India, because I am representing both of them as a liaison between the two organizations. So I'm thankful to all of them. My sincere thanks to Dr. Christian, who has really arranged for the funding. For he was the main person in arranging for the awards. That is his involvement. I know him since year 2007, and I know that even before that he was associated with all the stalwarts like Dr. Akbar Shah, and he is continuously supporting this organization. Thanks to the resource persons, Dr. Albert Lee, Dr. Amir Nazi, Dr. Suhail Parvez, who have accepted to arrange post-conference workshops. That is another dedicated work that these people are doing. We are very much thankful to them. We are thankful to all the speakers who accepted our invitations at such a short notice, and they really fantastically contributed to this conference. We are thankful to all of them. These are the real crusaders of 3 hours, and at such a short notice, without expecting anything, they are ready to participate, and that shows that the movement of 3 hours is coming to a great success. In near future, we are going to have not only academic kind of simulations, but we are going to have real wet lab alternatives that will be replacing animals as much as possible. That is the confidence that I have got through attending these sessions that were conducted here. So I'm really thankful to everyone who was involved in this. There are no words to thank the kind of asceticism that Sai India has shown. Sai India made this 4th annual conference of Sai India free of registration cost. This is something wonderful. And because of this online platform, we could reach the entire globe. The entire global scientists not only participated, but also listened to this. I'm happy to share that there were more than 1,200 clicks, hits on our YouTube channel. That indicates that more than 1,000 people are listening to us. Another important thing is all these sessions will be available on YouTube continuously for public access. So this is a wonderful achievement of this particular event. That's what I feel. I'm really thankful to everyone. Maybe I missed a couple of many names, but I'm sorry for that. With the consent of time, we will have to shift to our Dr. Akbar Shah sir's speech. I request Dr. Akbar Shah sir to please sum up the thing, and let's take the session ahead. Please, sir. Dr. Akashal, sir, you have to unmute yourself, please.
So we are not left with much time to go into extensively into matters. I would like to be as brief as possible. Though I have a lot of things to say, I can't say that at this moment because we have to go through the general body also.
Yeah, right.
Because it's also very critical. I need a few minutes to conduct the general body. So I would like to very particularly generalize, saying that all the speakers have been doing a wonderful job, and I thank each one of them for accepting my invitation. I mean, as rightly said by Dr. Patil, most of them are personally known to me for several years, and I could take liberty of asking them to just join us, and they all joined. So without mentioning their names, I would like to thank all the 13 speakers for accepting the invitation.
Prashant,
Yes.
Your voice.
Not getting?
No, it's all right.
No, sir, you are audible.
We're listening.
Okay. So I was just thanking all the speakers. I thank all the chairpersons who also had to spend time and be there monitoring the proceedings of the conference. And special thanks is again due to Dr. Christian, over and above his participation as a speaker. He has done a wonderful job of being the convener of the juries to select the best poster and the best oral presentation. And he's going to have another strenuous job to take care of. Tomorrow it's going to be a post-conference workshop with the activity to take place with the University of Kerala, Thiruvananthapuram, which is also going to be presented as video to many students and scientists. So Christian is, I owe a special thanks to Christian. And Dr. Patil and his team, wonderful, excellent contribution, excellent work. And he was praising me all along, but I am meant for that. And Dr. Patil took up this work when I never asked whether he is willing to do it or not. I just told him that you are doing it. So he did it. And thanks to him and thanks to the Vice Chancellor, who has such wonderful people in his university around him, supporting the progress he makes in the field of pharmacology education. So Dr. Patil and his team and the Vice Chancellor, the society owes a lot for all the success we made. And of course, over and above the Thanksgiving, 2-3 points to mention. First of all, a little elaboration about the price. So this price, the 3 oral presentation prices and the 3 poster presentation prices, this is paid from a grant sponsorship that comes from Episkin L'Oreal combined. Episkin L'Oreal combined. And without my asking, this never happens in the history, without my asking anybody to give some money. Christian, in his own interest, feeling happy about the way the society is organizing its programs, he came up saying that he would like his company combination to extend a grant to confer prizes to good presentations oral and poster. So it was very nice of him. So the money comes from L'Oreal, Episkin L'Oreal combined. This year, the quantum has been 1,000 euros, which is equivalent to almost 80,000. How much? 80,000 rupees. And this will be distributed as 3 oral presentations. We are going to award gold medals, real gold medals. First prize 4 grams, second prize 2 grams, and third prize 1 gram. A real gold coin, which will be embedded in a brass medal, and that will be conferred as the award. That's what we did during the Mumbai conference, and it is the same quantum of prize that is going to be given for this conference also. So, and because we are doing it in the online mode, we won't be able to present the award now. So what we will do is we will have the award winners to attend the next year conference. Let us pray and hope that it's going to be offline. So we will get those people participate in next year conference as well, and they will confer the medal in the next year conference. So that is the special announcement I wanted to make. And two things furthermore to say. We had just on a few days back, 27th of November, we had a satellite conference in commemoration of what was forthcoming on 11th and 12th of December. Dr. Rohit Sheth from Guru Ghasidas Vishwavidyalaya in Bilaspur, Chhattisgarh, he came up with the idea of a workshop-based conference, which we suggested to be a satellite conference. So that was very effectively conducted on the program, and we should particularly thank Dr. Rohit Sheth and his team of colleagues who undertook this responsibility and conducted the conference very efficiently. We thank the speakers and all those who participated in that conference. And similarly, we are going to have post-conference workshop for 4 days. And it's going to be like tomorrow, it's going to be reconstructed human epidermis, which is to be taken up by Dr. Christian Pelweisen, supported by his colleague. And the next day, it is going to be Suhail Parviz going to give a training in Drosophila model. And that is to be followed by Amir Nazir, to give training on C. elegans model. And on 17th, it is going to be the integrated discrete multiple organ co-culture. And the training is to be given by Dr. Albert Lai, who will join us online from USA. So this year has been its protracted activity, starting on 27th of November, ending on only 17th of December. And this is the first time in the history of the alternative movement in India, such an extended, protracted activity has been possible. So again, we should appreciate and admire the role each one of these speakers and trainers are going to play and going to play. Well, of course, I can go on speaking like this, but then I think I should stop here. A special word of appreciation to President Dr. Y.K. Gupta, Vice President Dr. Raisuddin, another Vice President Dr. Vijay Paul Singh, Joint Secretaries Dr. A.B. Pant and Adip Roy, Treasurer Dr. Kadalmani. So they have, and all executive committee members. They stood with me in supporting me to carry the activities forward. With these few words, I can go on speaking like I want to speak, but well, I also should appreciate all the young students, who came up with good presentations, both oral and poster. So those who are not conferred awards, they should try and come with better posters and better presentations in the next conference. I mean, the success is always there if you put effort and work hard to do that. So I think I should stop here, and I thank each one of you for the wonderful opportunity. Thank you very much, and
thanks a lot, sir. Thank you.
Bye.
Now I request our Honorable Vice Chancellor, sir, Dr. Ramesh Goel, sir, to say a few words about this activity, please, sir. Please.
Okay. Our President, Professor Y.K. Gupta, Vice Presidents, Dr. Raisuddin, and also the Secretary, Dr. Akbar Shah, Organizing Secretary, a very dynamic Organizing Secretary, Dr. C.R. Patel, and all the other officials, Professor Christiana, who is still so active, and after even during the session, I was listening and the way in which you were interacting with the student. First of all, I would like to say that I must compliment and congratulate for the successful organization of this conference and success of the society and the conference both. The success is measured by two things. Number one is that how the young participants are interacting. The way in which the papers were presented, the way in which the interaction held, I think it is worth comment. It is commendable. Second thing is that normally a conference has to give something, recommendations. And right from the beginning, if I start with Professor Y.K. Gupta in the first day in the inauguration itself, made few remarks. Based on that and others, like whatever I could see, this conference is also giving various takeaways. Number one is that we have to go with beyond 3 R's. Not only that reduce, refinement, or reuse, or reduction, and all that, but rehabilitation, what we talked. But two more important things which emerged to me out of several, the responsibility and the regulation. Now, just now, Professor Raisuddin told that you should not repeat the work. Very, very nice. The youngsters must understand this. But at the same time, I will little disagree, and I will rather say to all the youngsters that no, be product oriented. You may not get product right away, but lay the foundation, and maybe in few years you may have a success. It's not that you cannot get the success. Those things have been disproved now. Even in USA, the 5052B pathway, it indicates that yes, you can bring the drug in 2-3 years also. China has done like that. There are many others who have followed and done it. So this usage of the alternatives to the animal experimentation is not simply for teaching, but also for the research and new drug development. That's what the message which has been given. The very first lecture, the Dr. Pant from IITR was just wonderful, I will say. It gives the idea that how you can really develop the models which will reduce. See, the drug discovery has been transformed from that only. That there was there never used to be PKPD department. It started that. Toxicology, unfortunately, continued in some academic institutions like that, doing the same toxicity study for everything, which is probably not warranted unless you prove it that drug is effective also. But yes, it is important. But how to do it in the alternate manner, beautifully explained by Dr. Dr. Pant, and I think it has to be carried forward. Then, so this is one important message, that we should promote this concept of validation, what Dr. Y.K. Gupta told. This is very, very important. See, you're publishing, but okay, go it up to the validation so that it can get into the regulatory aspects. Our Indian CDSCO may start adding it to it. They need not to wait to the OECD or US FDA to do it. It can be done from India also. Why not? But yes, collectively, worldwide, if it is possible, it is good. And second is that, right, so this is very important takeaway matter. And then how to evaluate the drugs. How can you have alternatives for drug discovery itself, reducing the time? I used to talk more biomarkers and all that, but it is much more than that. Tissue bank, nobody thinks how important can be tissue banks. That itself is a big alternative, I can say, and reduce so many things, ensure certain success. That is also another thing which can be taken up maybe in future conferences. So this is what I feel. So this is a very, very big takeaway message. And lastly, of course, I am feeling a little embarrassed that I am attending this in the inauguration as well as in the valedictory, and I'm not the member of this society. So I am requesting Dr. Patil to do the needful, and I will
Sure.
within a week only I will do that myself, and let us see how we can do that. So this is I'm really thankful. In spite of that, you have given me this honor to be here, and I wish that many more conferences do come. I also reminded of the Sigma story. I used to come all the way from Ahmedabad to collect the Sigma chemicals and streptozin. Maybe a couple of times from CBT, that Mall Road, I used to come on and off. It is so youngsters are really lucky. They have a faster routes of drug discovery, toxicity, everything, and they should make best use of all this. Thank you and wish you all good luck. Thank you.
Thanks a lot, sir. Thanks
Thank
for your
you, sir. We welcome you to our society.
No, I told you. I mean, obviously, I just forget. I mean,
No, sir, it will be done.
Now, I request our President of Sai India, Dr. Vaike Gupta, sir, to please unmute. And hello, Dr. Vaike Gupta, sir. Yeah,
Am I audible?
yeah. Now you're
Yes,
audible.
yes, sir.
Please.
Oh, so greetings to all, and I would be brief because the time is we are already late. So I would start my saying with the compliments, appreciation, thanks to our honorable friend, Vice Chancellor, Dr. R.K. Goyal. Dr. Goyal, though you are not the official member of the society, there is a what is called as an honorary member who touches the heart, and you are such person. You have touched the heart of each and every member of the society because you have provided this opportunity, this platform to all of us, and then your thoughts. Even if you formally member till now, are such that it 100% matches with the philosophy of our society. So I would request whether we can hear the claps or not, but to everybody to clap for Dr. R.K. Goyal.
Thank you. Sir, I forgot one more thing to add. Thank you. Sorry, I'm interrupting you. See,
Sure.
another thing is that like what we did for Indian Pharmaco Society, that member was inducted in the CPC SEA. Let us make it that even SAE can also be one of the members in that.
Yes.
Some of the representatives.
Strongly recommend, yeah.
This is what I wrote, but somehow
Very good suggestion, and we will take it up.
I think, sir, we should these recommendations
Thank you, sir. Thank you.
to the relevant agency, sir.
Thank you.
Absolutely. And that's what I'm saying. Dr. R.K. Goyal is not only the honorable and honorary member, but I would call him as a very good philosopher, friend, and mentor. So thank you, Dr. Goyal. And with that, I also thank profusely the innovator mind of Dr. Akbar Shah, who thought of having this society, and then entire his department, and the collaboration association of Dr. Raisuddin, Dr. Pant, Dr. Vijaypal, and Dr. Adig, and so many people in this group who pioneered this to make the society what it is today. And I always give an example. Even today, now when I am in Vijayawada, I will just Visakhapatnam. I mentioned that a few words about this society, how relevant this society is, and therefore, and I also have all admiration on behalf of the society. Of this, of course, I have thanked the leadership of Dr. Well, but Dr. Patil, my young brigade, Anup, Sachin, and the entire team of College of Pharmacy. In today's, when the technology is progressing, the technology failure is also a fear. But in this entire 2 days and previous pre-conference workshop, and I'm sure in post-conference workshop also, there is absolutely almost zero failure. I think that indicates the success. I am so happy that 1920 speakers on different topics from India, including my friend Panji, who I admire always for wonderful delivery concept, Dr. Vijaypal and Dr. Christina, staying here for so long for judging so passionate speakers that it would have been difficult to assess that who is good, who is better, who is best, because they were all the best. I would say, even when our team had a difficult time, purity, to assess that who is best, in my opinion, anybody in this society who is working for animal experimentation alternative deserves an award, because that is where you are doing something different than the common league. And my congratulations to each and everybody who is presented and who is working on it. Important thing which I will always say, as Dr. Goyal has already reiterated it, that today the time is that we think out of box. There are two things. One is you validate the already existing model. For example, there is a Parkinson's model, there is a Huntington's model, the neurodegeneration model, there is a hypertension model, or maybe organ and chip model. And you are just, what you're doing is revalidating thing, and then you're saying, once you are doing revalidation, also put as the society responsibility that how many animals you have saved, how much more efficacy in the system you have developed, and how much time you have saved and how much cost you have saved. And the most important is how much animals you have saved. So that objectivity will only be justifying our existence. It's not only that we are developing an alternative, but alternative with a philosophy to save the lives of the animals who are equal right, who have the equal right to stay on the planet with us, as comfortable life as we do. That is important. I will just give you another dimension of our objective. Today I inaugurated the IAMPZ workshop, which is one of the best devices infrastructure facility the government has created in Vishakhapatnam, where 90 odd device manufacturing units make in India under program, starting from the devices, processes, coronary stents, and all those. We are facing challenge, regulatory challenge, how to do the safety, toxicity, efficacy of these, particularly toxicity. I suggested that now this is the time that we should work with the society, which I mentioned there, and academic institutions to develop alternative animal models to validate the safety of these. It's not necessarily that we have to just do the same thing, but we can innovate new dimensions, we can give new methods, that this is the method which will associate safety, and then give this direction to the regulator that hey, this is the regulatory requirement for safety of this device, which are now being considered, will be considered as a drug, and therefore this society, as Dr. Goyal has very rightly mentioned, should be involved as a thought leader or input provider or the method provider or the regulatory guidelines provider to the regulator for this. We are not doing experiments, but we should also do the validation, and based on validation, the utility of this validated process into the regulatory framework. That is our objective. And finally, I would say, in last few years, or maybe last couple of years, many institutions have started working. whether it's C. elegans, zebrafish, Drosophila, or maybe organ chips. But if you see how many of them are connected as a network with each other. Publication I always get irritated when people say, oh, US publication, UK publication, such and such Andrews has publication, Christina has publication, this one is published like this. But you forget to acknowledge what Dr. Pant, what Vijay, what the JRF is publishing in their work. So first recognize the work of Indian laboratories, Indian scientists, publicize them, make a network of each other, know each other, meet each other, and then exchange the technology, techniques, and the thought of each other. And that is the major purpose, what I think this society should do. Network, network, and network within India and later outside. And that should be projected globally. That yes, this is the validation across India, and now we are going to cross-validate across the world. So with that, I think the young brigade, which is now coming up with this, and I just told you that we have now cleared the regulatory process for the Drosophila, Tanzanian Drosophila to be imported, and that would be a strong step. Not we have cleared, but we have recommended, and it will get cleared because this already have been endorsed last 2 days with the CSIR secretary and DBT secretary, and this will has to go with it with the DGFT, and this will be done. And that is so. We should publicize these success stories in ourselves to boost our morale. So I again thank each and everybody, the office bearers and the members, and we attract more and more members, and I think a great satisfaction. I was a bit unlucky that I could not attend the entire 2 day session, but I attended quite some time. So thank you very much, Dr. Akbar Shah. Thank you very much, Dr. Goel, and thank you very much, Dr. Raisuddin, and of course, Dr. Patil and entire his team, and all those who attended this. Thank you very much, and see you again sometime.